Welcome to the deep dive. You sent over some really interesting material on aquaphobia, that intense fear of water that seems, well, often irrational.
Mhm.
We've got this psychological overview that really tries to unpack what it is, how common it might be, and, what causes it.
Yeah, it's quite detailed.
So the plan is to, well, dive right in using the sources you shared and really get a clear picture together. Sound good?
Absolutely. Let's get started. It's fascinating just how they define it.
Right. Aquaphobia, the name itself is pretty direct, isn't it?
It is. Comes straight from Latin aqua, meaning water.
And in Greek, phobos, fear.
Exactly, fear of water.
Right.
But it's not just, being a bit wary. The DSM-5-TR classifies it specifically
Ah, the DSM. How does it categorize it?
as a specific phobia, natural environment type.
Okay, natural environment type. So like fear of heights,
Mm.
acrophobia, or thunderstorms,
Yeah,
astrophobia, that kind of thing.
precisely. It fits into that category. And the core idea is this really intense fear of something that objectively poses little or no actual danger in the specific situation.
It's the reaction that's disproportionate.
Exactly. The intensity is key. And something important to clear up right at the start,
What's that?
the difference between aquaphobia and hydrophobia.
Okay, yeah, I've heard both terms.
So technically, hydrophobia is the more accurate Greek term hydor for water, phobos for fear.
But there's always a but.
Well, yeah. But historically, and even now, hydrophobia has become almost exclusively linked to a symptom of late-stage rabies.
Oh, right, that difficulty swallowing, the fear of liquids because it's painful.
Exactly that, the inability to quench thirst. So it
Mhm.
carries that very specific, very serious medical meaning.
So to avoid confusion, when we're talking about the psychological fear of water pools, lakes, oceans, whatever the term we should be using is aquaphobia.
That's the standard convention now, yes. Keeps
Yeah.
things clear.
Got it. Okay, so how many people actually experience this? Is it common?
Well, the figures are quite revealing. There's a big study, looked at 22 countries.
And what did they find globally?
On average, about 2.3% prevalence for what they called fear of still water or weather events. So water fear is part of that.
2.3% globally. Okay. But I noticed the US numbers seemed higher.
They did, yeah. Significantly higher in that same study framework, 4.3% in the United States.
Wow, nearly double the global average found in that study. Any theories why? The sources don't really say, do they?
No, they don't pinpoint a reason for that specific U.S. difference, but, we could speculate a bit. Maybe it's cultural attitudes towards water, maybe media influence. Hard to say for sure.
Interesting thought. What about other places? You mentioned Iceland.
Yeah, interesting data point from Iceland. Surrounded by water, obviously.
So you'd think maybe less fear or more.
Well, research there suggested it might affect up to 1.8% of the population.
Okay, so lower than the US figure, but still nearly 1 in 50 people. That's not
No,
insignificant.
not at all. It shows it exists even in cultures very connected to the sea.
Right.
And the U.S. data gets even more specific. It breaks it down by type of water. Like
Right.
46% of U.S. adults said they were afraid of deep water and pools.
46%. That's huge.
And even higher for deep open water lakes, oceans, 64%.
64. Wow. So maybe it's not always a full-blown phobia for everyone in those stats, but certainly a significant level of fear or anxiety around water for a lot of adults.
Absolutely. It really highlights the spectrum. And it's important to remember, specific phobias in general, they're actually among the more common mental health disorders.
Right. So aquaphobia isn't some incredibly rare thing. It fits into a known pattern.
Exactly. It's not something to be dismissed easily.
Okay, so we know what it is, roughly how common it is,
Mhm.
but what's behind it? How does it start? How does it, manifest in someone's life?
Well, the psychological view suggests it's usually a mix of things,
Mm.
not just one cause. Often it's a combination of experiences and maybe some genetic or temperamental factors.
A combination. Okay. The sources listed 5 common causes,
They
right?
did. Let's walk through them.
First one, instinctive fear of drowning.
Yeah, that feels pretty fundamental, doesn't it? We're wired for survival. Water can be dangerous if you can't swim or get into trouble.
So that basic caution can just get amplified into a phobia for some people.
That seems to be the idea, yes. Then the second cause.
A past experience of personal horror involving water.
This one's pretty straightforward. A traumatic event, like nearly drowning, or maybe seeing someone else in distress in the water. That can leave a really powerful negative association.
Understandably. Okay, number 3 was about parents. Having an overprotective parent or a parent with aquaphobia.
Right. This touches on learned behavior or modeling.
Yeah.
Kids watch their parents, right?
Mm-hmm.
If a parent freaks out around water or is constantly warning about its dangers, even subtly, the child can absorb that anxiety,
Yeah.
learn the fear, essentially.
Without even having a bad experience themselves.
Exactly. It can be learned indirectly.
Okay, the fourth one. Psychological difficulty adjusting to water. What does that mean exactly?
It's a bit more internal, maybe. It could be about feeling out of control in water, the sensory experience being submerged, not feeling solid ground.
Hmm.
For some people, that whole environment is just deeply unsettling on a psychological level.
A sort of fundamental discomfort or vulnerability?
Could be, yeah. And the last one they list is lack of trust in water,
Lack of trust. That's an interesting phrase.
isn't it? It suggests this feeling that water is unpredictable, maybe inherently unsafe, perhaps from never learning to swim or hearing scary stories, seeing movies, just not feeling confident or safe in it.
So really diverse roots.
Hmm.
Instinct, trauma, learning, internal feelings, lack of familiarity.
A real mix,
Yeah.
which probably explains why it manifests in different ways, too.
Let's talk about that. How does it show up? The sources gave some specific, quite intense examples.
It did. One mentioned severe pain accompanied by tightness of his forehead. Another described a choking sensation.
That sounds awful.
Yeah.
Really physical reactions.
Definitely. And discrete panic attacks are also mentioned. Those sudden waves of intense fear.
Heart racing, can't breathe, feel like you're losing it.
All of that. And it can even impact basic things like one example mentioned someone reducing their fluid intake because of the fear.
Wow. Affecting even drinking water. That's extreme.
It shows how pervasive it can become. And then there are the more general physical symptoms listed.
Right, things like nausea, feeling dizzy.
Numbness, shortness of breath, naturally, increased heart rate, sweating, even shivering, regardless of the water temperature.
It's the body's fight or flight response kicking in, basically.
Pretty much. And it aligns with the general symptoms seen across many specific phobias.
Yes.
Physically, trembling, feeling hot or cold, chest tightness, butterflies,
Feeling faint, dry mouth, ringing ears, confusion.
all potential physical signs.
Hey.
And the psychological side is just as powerful.
Yeah, the fear of losing control, fear of fainting.
That overwhelming sense of dread, and even in intense moments, the fear of dying.
It really paints a picture of how debilitating this can be.
It certainly can. But the good news is it's treatable. The sources are clear about that.
Okay, good. So, what are the options? What helps?
Several approaches are mentioned. Hypnosis is one. Systematic desensitization is another classic technique.
Slowly getting used to the feared thing.
Right. Cognitive behavioral therapy, CBT, is very common for phobias. Exposure therapy, which is related to desensitization. And sometimes medication might be used maybe to manage the anxiety symptoms alongside therapy.
And we have those couple of case studies, too, which kind of bring the treatment to life.
Yeah, they're brief but illustrative. The first one,
A 28-year-old woman, aquaphobia since childhood.
right. She had treatment combining hypnosis and systematic desensitization. It was relatively short, 8 weeks, just 5 sessions.
Then did it work?
Apparently, yes. They reported positive outcomes, and importantly, those results held up at follow-ups 2 months and even a year later.
That long-term success is really encouraging.
It is. And the second case was, well, even more severe on the face of it.
The 37-year-old man, 10 years of extreme aquaphobia, couldn't even drink water comfortably.
That's the one. A really profound impact on his life. He underwent 6 sessions of hypnotherapy.
Just hypnotherapy.
Seems so, according to the summary. And again, the therapy was reported as successful, and crucially, no relapse mentioned at the 6-month follow-up.
Wow. So even in these really tough, long-standing cases, therapy can make a real difference.
That's the takeaway, yeah. These interventions can be very effective.
That's definitely hopeful. Now, just before we wrap up, they mentioned a related phobia, thalassophobia.
Yes, thalassophobia, fear of the sea.
So how's that different from general aquaphobia?
Think of it as maybe a more specific subtype. Aquaphobia can be about any water, a bathtub, a pool, rain. Thalassophobia is specifically about large, deep, open bodies of water, the ocean, the sea.
So fears about the vastness, the depth,
Yeah.
what might be in the water.
Exactly. Those tend to be the core elements of thalassophobia. It's still a water-related fear, but with that specific focus on the sea and its perceived dangers or mysteries.
Got it. Part of the same family of fears, but with its own flavor.
A good way to put it.
Okay, so let's try and pull this all together. We've seen aquaphobia is, well, a recognized specific phobia. It's distinct from hydrophobia, the rabies symptom.
Right. Important distinction.
And it's actually relatively common, though the figures vary quite a bit by place.
Yeah, those U.S. numbers showing significant fear, especially of deep water, were pretty striking.
We looked at the causes could be instinct, trauma, learned behavior, other psychological factors. A real mix.
And how it manifests intense physical and psychological reactions, panic attacks, avoidance.
But crucially, there are effective treatments.
Hmm.
CBT, exposure therapy, hypnosis, we saw those case studies showing real success.
Absolutely. The prevalence numbers show many people are dealing with this, but the treatment information offers real hope.
Exactly. Understanding the causes, the symptoms, and knowing help is available that can be, well, really empowering if you're someone experiencing this. It doesn't have to just be endured.
Hmm. Which leads to maybe a final thought for you, the listener, to chew on. Given how common this seems to be, based on some of those figures and the wide range of reasons why it might develop, what does that tell us about how society maybe views or misunderstands these kinds of specific phobias?
Mhm.
How do our own experiences with fear versus maybe a more clinical understanding shape how we react to fears like aquaphobia in ourselves or in other people? Something to think about.